If we can crack the end-of-life scenario, that's probably worth £170 million to the system.
So one of the problems we have at the moment is that we end up duplicating information if we create a separate document. Within EMIS, there's a template system which pulls across the key data that's already stored in the system, and it then allows us to fill in the gaps. From a GP's perspective, is a fantastic step forward.
What we've created there is a searchable, virtual, single record for patients in London. 86,000 people die in London every year. If we can help them to die where they want to die and receive the care in the way they'd like to receive it, we're going to give huge benefits to patients. There's millions of pounds at stake here to the NHS as well in terms of wasted time and unnecessary admission. What we're about to show you is real-time information exchange between all 4 suppliers and the creation of a single virtual record for Kenny that's also managed virtually via an IHE-based information exchange. So some time ago, before Kenny became ill, his GP connected to the London Health and Care Information Exchange and joined other data controllers across London who'd done the same thing. In our demo today, only 3 organisations have joined. These are Kenny's GP Practice, Trinity Hospice, and an instance of the NHS 111 service. Imperial, who are providing him with support for his cancer treatment, have yet to join. So I've already created my personal identity using another process. And in this screen, I'm applying to join the exchange and I'm asked to enter my organisation's details. And I'm going to click yes to this. I'm being asked to confirm that I want to set up a data processing agreement for direct care. I confirm that I do, and I sign up to the terms and conditions. So that's a single information sharing agreement for anybody in London processing data for direct care. So moving through the tool, there are now 5 tabs that I can use to set my own, as a data controller, information sharing preferences for my organisation. We talk about permissions. So who am I going to authorise to see my data? What types of people? I'm going to allow doctors and nurses to view any of the data I publish. So I'm happy with that. I'm done. And going back to the main console, we can also see that should I want to, there's some other things I can do. I can review who's using my data. So we're going to move on to the next step in the journey. And this is Kenny creating his online account. So he's with his GP and they're having a conversation about his ongoing care, and he's clearly going to need a lot of support. They've discussed how Kenny might benefit from having his personal health budget, and they've all recognised that he will need support from many different professionals. And the GPs explained that bringing this to life for Kenny will be a whole lot easier if he creates his online account. Kenny can see the sense of sharing information for the purposes of direct care, and we don't currently offer him any further choices to limit data. So he's essentially done. He's going to click yes, and he's going to share, and he's going to arrive at the summary page. And he's got an option here to add his own data. Again, this is a mock-up, but the notion that the citizen should be able to, as part of creating their account, to provide some information to the NHS so that the NHS remembers him is what we're trying to bring to life here. And in this screen, we're explaining that we're going to have to ask him some questions about his identity in order to assure and confirm his identity. And we're not going to create an identity for him today. We're going to assume that he already has an identity. There's a list of all the national identity providers we could use here. So the one he's joined already is the Verizon Identity Service. So he's going to click yes, and he's going to, essentially that's it. He's signed in using the identity he's already created. Here's his fully configured personal online account. And if we scroll down, there's a bunch of things he can do. Just to remind you what we've done, Imperial have joined the exchange and confirmed they're happy to share information with other organisations that are already connected to the exchange. And one of those organisations that's already joined is Kenny's GP Practice, and another is a local hospice based on the other side of London, recognising that we have 30-odd information exchanges that don't talk to each other. Kenny's enabled information exchange for the purposes of direct care, and both he and his GP are now able to see which organisations are able to connect to the exchange and what sorts of data they intend to share. And one of the data sets that Kenny's Practice is very keen to share via the exchange is Kenny's end-of-life care plan, which includes information about Kenny's end-of-life preferences or place of care preferences. And in essence, this document is one that everybody in the NHS would want to see, and it outlines what should happen when Kenny reaches that critical point in his journey. So we've worked hard with the clinical community and national standards body, PRSB and others, to define the content of this document and to turn this into a format that could be machine read. This means that GP systems such as EMIS can create the plan And end users such as Cerner and CMC and others can reconstruct that data in their systems and present it to the user as part of the workflow. So the addition of the record location service means that that document or the data set contained within that document can actually be located and retrieved by any organisation or any compliance system in London. So we're going to start with EMIS, and Tim Hill's here from EMIS. Just to emphasise, place of care, golden thread here.
Yeah, place of care is golden thread, so that's currently at home.
So his preference is to be cared for at home.
That's right.
Okay. What's happened in the background is that the GP has published the care plan to the Affinity domain with a copy of where it is stored being held in the registry using the architecture. The data's been published, everybody can see it, and we'll move on to the next step. And we're now going to journey to the multidisciplinary team meeting at Imperial. And Kenny's care plan has been updated a couple of times since Phil created it, and today they're meeting to discuss his care. So David's going to play the role of the care coordinator, and he's going to search for Kenny's record in Cerner.
From here, we can click through and link to the Cerner Health Information Exchange. The Cerner Health Information Exchange forms part of the standard workflow to access a patient's longitudinal record beyond the four walls of the hospital. Cerner Health Information Exchange is a technology that uses the global standards for interoperability. That is happening live now.
That's real time.
Yes.
That's actually happening. There's a communication going on in the background between Cerner and the Intersystems registry. Just to see what's happened there, Imperial have made a request to the registry for the data, which was stored in the Affinity domain, and it's been retrieved to Cerner at the Imperial site. That's real-time viewing by Cerner of data created in EMIS and made available using the XDS record location service. We're moving structured content using CDAV3 compliant machine readable standards, and the user hasn't had to initiate a separate search for the data. And it's all enabled by this single information sharing agreement and the patient consent that was previously provided. And we're now going to talk about respite care. So further time has passed and Kenny's condition has deteriorated. He's been admitted to a hospice for respite care. And the hospice is registered with the Information Exchange. And Di Howard is a nurse working in the hospice in South East London. So you're using CMC as your application.
I'm looking on my patient list. So I'm the community palliative care nurse. I see that Kenny is there, and I want to look at his care plan. I want to update Kenny's care plan because while he's been in the hospice, he's had a reflection as to where his preferred place of care is. And where he'd originally said he wanted to be cared for at home, he's now decided that he would like to be cared for in the hospice. So I'm going to update his care plan, and I'm now going to approve those changes.
Okay, so that means you've published it to the Information Exchange.
So I have approved it as a clinician, that change of Kenny's mind, and that is now available for everyone to see.
So we started off with Kenny with his end-of-life care preferences set at home. Now we've changed it to hospice.
Okay, so here we are in the EMIS Web Document Manager screen. We have a matched document that's come in of today for Kenny, and that's been matched via his NHS number. And here, I can scroll, I can see the demographic details that I've come across there. I can also highlight, because it's captured in his record, an additional code that is highlighted, and the clinician can actually add that information to his clinical record should he wish. And in addition, you can see the patient preferred place of care has now changed to hospice, and that can be actually coded and added to the record in real time.
So what happened here was that Trinity Hospice updated the care plan, which created a new version of the care plan. And remembering, XDS can handle version control. So you create different documents each time you create a care plan, and the XDS stack handles presenting the latest version to the end user. And that prompted a piece of information back to the registry to say this is where I've stored the data. Imperial then retrieved the data. Well, actually, it was EMIS first, wasn't it? But anyway, so they said, can I access that data, as did EMIS. And what happened then was that the data was retrieved and presented back to EMIS and Imperial. It's been done in real time between clinicians in different organisations. The data is essentially staying where it is because each data controller retains control of their own data. And the consumption of that data has been through the workflow in the native system, i.e. Cerner or EMIS or whatever it was. And the XDS registry can provide management of the version control, and we can use other standards like HL7 to send notifications and alerts as part of a workflow service provided by that record location service. So we move to the last step in the journey, and unfortunately, Kenny's conditions deteriorated a bit more, and you'll recall that Kenny spent a lot of time talking to his GP about his end-of-life preferences, and these were captured in that care plan and subsequently changed. Anyway, Kenny's daughter's now called 111, now renamed Integrated Urgent Care, and she's very worried about her father.
Whilst a summary care record can give us some really important information, what we don't get is the rich information, such as where the patient wants to be cared for, if a crisis happens, what do we need to do in order to make sure that the patient gets the right care, and to make sure that we can identify if the patient's chosen a place where he wants to die, then basically we're able to make sure that those wishes are fulfilled. Whether they're a mental health crisis plan or end-of-life plan, as Kenny is, we're able to see the detail of that record. If patients have entered in their information about the way that they want their care plan to be, or their care to be delivered, particularly at times of crisis, we can follow that. When patients have taken the time and the trouble, or had really, sometimes these are difficult conversations that they have with their nurses or their doctors around these choices, we're able then to follow those through, even if those discussions take place some months or weeks ago. We're able to see those and be able then to deliver those particular wishes. And that's the important bit. Some of the important things I need to show you that's important around this system is basically, as we've already said, it goes straight to the nurse. The nurse will then seek the record, open up the record, and following their clinical triage system, they're able then to pull through that information. Kenny's already decided that where he wants his care and where he'd like to be transferred if there is a crisis, then basically he's already identified that, which is the hospice. What we would then be able to do is to send that information electronically to dispatch an ambulance to make sure that, one, they can sort out sort of any immediate care needs, so do some sort of see and treat issues if there's issues with pain management, but then they'll also be able to convey Kenny as to where he wants to go.